meningitis depends on your age, overall health, medical history, the extent of the disease, and the organism that is causing that disease. Other factors that determine your treatment are your tolerance to specific medications, procedures, or therapies, your opinion or preference. Now we are going to see about the specific treatments that are available for specific microorganisms that cause meningitis. For bacterial meningitis, the treatment is usually by intravenous antibiotics. Now, what do antibiotics do? Antibiotics will retard or stop the growth of bacteria. As far as concerned with bacterial meningitis, the earlier you start the treatment, the better will be the outcome. Viral meningitis. For viral meningitis, there is no specific medications except for the meningitis caused by herpes simplex virus. The only way to treat viral meningitis is through supportive care. For fungal meningitis, the treatment is usually done by using intravenous antifungals. Since prevention is better than cure, now I am going to tell you about the preventive measures that we can follow to prevent ourselves from getting meningitis. Don't share your personal belongings. Keep yourselves away from infected people. Wash your hands vigorously. Boost your immune system by taking healthy foods such as fresh fruits and vegetables, whole grains, and lean proteins. Exercise regularly and sleep well. Get prompt treatment if you have been in close contact with someone who has meningitis. There are several vaccines to prevent bacterial meningitis, and these vaccines are recommended primarily for infants and children. Also, in certain health conditions, your healthcare provider may recommend you some meningitis vaccines. These conditions include chronic lung disorders such as emphysema or COPD, heart diseases, diabetes, chronic renal failure, decreased immunity status, and certain blood-related disorders. Recovery. If you are diagnosed with viral meningitis, you will find that symptoms improve within a few days and most recover fully after 1 to 4 weeks. It is common for you to experience tiredness for a longer period following this. If bacterial meningitis is treated early, there is usually a gradual improvement in symptoms within the first 2 to 3 days. If you don't treat it immediately, then you will face issues such as hearing problems, seizures or epilepsy, hydrocephalus, memory problems, change in personality and behavior, speech problems, and weakness on one side of the body. If this bacteria gets into your bloodstream, it causes septicemia. Other tissues can also be damaged. Only 10% of people with bacterial meningitis don't survive. Also, if they survive, they have to battle through seizures, brain damage, hearing problems, and other disabilities for the rest of their life. I'm going to tell you some recent news regarding meningitis. There was a prolonged controversy that the Spanish flu was caused by random dosages of experimental bacterial meningitis vaccine, but recent research articles state that it is not so. A team from INRS had demonstrated the effectiveness of an inexpensive molecule to fight antibiotic-resistant strains of the bacteria responsible for gonorrhea and meningococcal meningitis.